9 incidental facts about eating disorders. Eating disorders, including anorexia nervosa, bulimia nervosa, and binge eating disorder, have the highest mortality rate of any mental illness. Despite improved research on the topic, eating disorders are vastly misunderstood by the general population. Sadly, the persistent myths surrounding eating disorder make it harder for people with eating disorder to get the help needed to fully recover. As a result, in May 2015, 13 US-based eating disorder organization in collaboration with Santhia Bullock, PhD, FAED, who serves as a distinguished professor of eating disorder in the School of Medicine of the University of North Carolina at Chapel Hill and professor of medical epidemiology and biostatistics at the Karolinska Institute in the Stockholm, Sweden, published the 9 Truths About Eating Disorder. This document was inspired by Dr. Bullock's 2014 9 Eating Disorder Myths Busted talk at the National Institute of Mental Health Alliance of Research Progress meeting. The 9 Truths document reflects the culmination of some of the most recent research on eating disorders. It is hoped that the common messaging will challenge myths and stigma, increasing and increase understanding about and compassion for those with eating disorder, and help pave the way for greater access to adequate treatment. Dr. Bullock said, the single best way to fight stigma is with truths. These consensus nine truths are the new scaffold on which we will build our advocacy effort for eating disorders. United around this principle, we can enlighten public understanding about eating disorder and advocate effectively for treatment access and resources. The following is an introduction to these the 9 truths along with their corresponding myths. Eating disorder truth number 1. Myth 1. You can tell by looking at someone that they have an eating disorder. Truth 1. Many people with eating disorder look healthy yet may be extremely ill. People commonly believe that you can tell whether someone has an eating disorder just by looking at them. This is because most people picture a person with an eating disorder as someone who is very emaciated. The reality is that eating disorder can present in diverse ways that and among people of varying sizes. It may not be obvious that an individual is ill. Eating disorder truth 2. Myth number 2. Families are to blame. Truth number 2. Families are not to blame. Family members can be the patient and providers' best allies in treatment. For many years, parents, especially mothers, were blamed for causing eating disorder. This is still widely believed that thanks to recent research and advocacy efforts, we know this to be false. Eating disorders are caused by a complex interplay of genetic and environmental factors. We also know families can powerfully contribute to the solution. Eating disorder truth 3. Myth number 3. Mothers are to blame. Truth number 3. An eating disorder diagnosis is a health crisis that disrupts personal and family functioning. Dr. Bullock felt that the blame on mothers was so great she reiterated it as a myth in her talk. Eating disorder can be lethal. They can have profound effects on the body, interfering with an individual's ability to function. They increase stress on the entire family. Meals can become tense, relationships strained, and family patterns disrupted as families struggle to cope with an internal crisis. Eating disorder truth 4. Myth number 4. Eating disorders are a choice. Truth number 4. Eating disorders are not choices but serious biologically influenced illness. Eating disorders are often dismissed as illness of choice and vanity, or the consequence of a deliberate adoption of an extreme diet. However, these disorders have far more complex origins. They are not merely a rigid diet that someone can easily choose to abandon. Low weight and restrictive eating patterns biologically alter an individual's psychological functioning and become firmly rooted. Eating disorder truth 5. Myth number 5. Eating disorders are the province of white upper middle class teenage girls. Truth number 5. Eating disorders affect people of all genders, ages, races, ethnicities, body shapes and weight, sexual orientations, and socioeconomic statuses. Eating disorders are commonly believed to be an application of affluent white females. This is far from the truth. Eating disorders affect both males and females. Families from different ethnic backgrounds and people from varied economic circumstances. This dangerous myth keeps many who do not meet the stereotype from recognizing that they have an eating disorder and accessing help. Eating disorder truth 6. Myth number 6. Eating disorders are benign. Truth number 6. Eating disorder carry an increased risk for both suicide and medical complications. All eating disorders, bulimia nervosa and binge eating disorder included, carry with them a risk of increased death. Medical complication may include problems with the bodily systems. Suicide is a common cause of death for a person suffering from eating disorder. If you are having suicidal thoughts, contact the National Suicide Prevention Lifeline at 988 for support and assistance from a trained counselor. If you are a loved one are in immediate danger, call 911. Eating disorder truth 7. Myth number 7. Society alone is to blame. Truth number 7. Genes and environment play important roles in the development of eating disorders. The factors that cause eating disorders are complex and not well understood. Current research suggests that approximately 14% to 16% of the risks for anorexia nervosa, bulimia nervosa, and binge eating disorder is genetically influenced. Chance and bad luck play a role, and individuals vary in their genetic risk. Even despite every common preventative measure, those with extremely high genetic risk may go on to develop an eating disorder after just one or two otherwise unconscious triggering events. Others with low genetic risk may escape an eating disorder despite exposures to numerous environmental risk factors. Eating disorder truth number 8. Myth number 8. Genes are destiny. Truth number 8. Genes alone do not predict who will develop eating disorder. It is doubtful there is a single eating disorder gene. More likely, variation in several genes contribute in differing degrees to traits that interact with environmental factors to increase or decrease certain individual risks for these disorders. Eating disorder truth number 9. Myth number 9. Eating disorder are for life. Truth number 9. Full recovery from an eating disorder is possible. Early detection and interventions are important. In the past, we lacked effective treatments and many remained chronically ill. With the earlier introduction of treatments that prioritize regulation of eating and address symptoms directly, more patients are achieving full recovery.